introduce themselves. There goes that little cue. And then, Robbie, would you mind introducing yourself first, and then so people know who you are? But then Camisha will start off with her presentation.
Yeah, hi everyone. I'm so excited to be here in this space with you all today. I'm so excited. My pronouns are she, her, hers. I work at the Southern Plains Tribal Health Board, the Oklahoma Area Tribal Epidemiology Center. I serve as the Native Test Program Coordinator, which we'll go into a little bit of that later, but we work with HIV and STI realm of the field. So I'll pass it over to Camisha.
Hi everyone, my name is Camisha Emarthla. I work for the Iowa Tribe of Oklahoma. I work for the Perkins Family Clinic Community Health Department. I wear multiple hats. So some days I do community health work, some days I do admin work. Um, just kind of depends on the weather, I guess. But we do a lot with Robbie's group. She is one of our favorite people because she gets us all of our supplies. So we'll talk about that a little bit more as well. But I will go ahead and see if I can get my presentation pulled up. Okay, let me know when you guys can see my screen.
You're good. We
Okay.
can see it, but you got your stuff on the side, so it's not the full slide. There it is. Perfect.
Good.
Got it.
Okay, perfect. All right. So I am with the Perkins Family Clinic. This is just a little bit about our facility. I just like to put this information here just to kind of give a little bit of an idea of the people that we serve. So we work for the Iowa Tribe of Oklahoma. However, our clinic is open to both natives and non-natives, and we are tribally ran. The Iowa Tribe has, this is kind of an old number, but they do have over 800 enrolled tribal citizens. And we are located, our jurisdiction is located over 4 different rural counties. So some of the barriers that we face are transportation and financial. That's the majority of where our health disparities come from. But we do have, quite a few services that we offer within our facility. We have a really great dental group, behavioral health, our clinic, our medical clinic. We also have x-ray. We're in the process of building a new clinic, so that's really exciting. I think it's scheduled to be finished next year, but it's really great to know that we're expanding and all of our programs really work well together. So that's Robbie was able to help our behavioral health group out at an outreach event that they had. I think that was 2-3 weeks ago. They had quite the turnout. So all of our programs intermingle, and it's really nice that we're able to do that. On the community health side, we do a lot of outreach, and that's where a lot of our prevention work comes from. So if you see that picture on the bottom left, that is our newly renovated community cabinet. It started off as like a small bookshelf type cabinet, but we were able to expand when we were given more space. We were staffed to the brim in our old building, so they ended up having to give us some more space, and we were able to make use of our entryway. So that community cabinet has really come in clutch. We are able to provide food items, non-perishable goods, hygiene items to anybody who wants them. We keep the very front door open at all times, and then the next door over is the keypad entry to our office area. But in that upper left corner is where we keep a lot of our prevention materials. So the black bag that you see on there, each of those bags have 20 condoms and 5 lubricants. There's also information in there about Native Test, Robbie's program, with a QR code for people to scan. And we give those out a lot at our outreach events as well. We also have within our facilities condom receptacles, and those have been very popular. So we initially faced some barriers when we were getting those installed. We had some pushback from other programs, but we were able to navigate that. We were able to really stress the need. A lot of it is just access, especially with our young adults and our teens. These receptacles aren't super costly. I put the screenshots from Amazon on here just in case anybody else has a program where you're looking to do something. I know somebody had said that they were looking at getting a receptacle, but it costs like hundreds of dollars. And I thought, there's no reason to spend that. You just need something with a lid. You can make it work. So we used candy bowls to start off with, and then we were able to get some of the acrylic dispensers. Robbie's program was able to help us with that as well. But we do have those located in all of our tribal facilities as well as our clinical sites. that also includes our wellness center. So our wellness center is our gym, and it's open 24/7. So we see a high demand there. We have a lot of people that come in, I think in the afternoons and after hours. Those are the ones that we have to refill the most, but we are able to really utilize those within our community. This is an example of our sexual health questionnaire that Robbie Bright was able to help us with. So some of the things that we are trying to implement within our facility, we've been working on the prevention side. Now we need to implement more within our clinic, and we're trying to really work on getting standardized questionnaires at any appointment for any patient that may fall within the guidelines of being sexually active. So this is something that we're looking at incorporating into our EMR system. So that way our providers are able to do this questionnaire with them. And then we're also trying to get this with our registration. So that way, if we do have someone who comes in, they're a young adult, and they are sexually active, we can give them this questionnaire. Just, it's kind of the same as the other questionnaires that you would see at other appointments. And it's very easy to understand. And we're hoping that with this questionnaire, we'll be able to really identify a higher need for testing and being able to implement more testing within our facility. So this is a screenshot of our native test kits that have been ordered within the jurisdiction for the Perkins Family Clinic. This program we have really been able to promote well. At any of our outreach events, we are able to really promote it in the sense that this is something that you can do in the comfort of your own home. And I think that's really important to stress, especially with anybody who's already kind of hesitant to come into the clinic. I think when it comes to sexual health, we have a lot of people in our community who are really hesitant to get treatment or get tested. I think there's a fear, there's still a stigma. So those are some of the things that we're seeing here. But these native tests, we're able to give out the cards with the QR codes. We can give these to teenagers. We had an event where we were able to go to a Thunder basketball game, and we had, I think they said there was over 1,000 participants there, but we were able to really target a lot of teenagers and say, hey, this, I know this is a hard subject to talk about, but go ahead and take this, because if you don't need it, someone else might need it. But you can scan the QR code. They'll send you the testing information. They'll send you the information, and then they'll send you the test in the mail, and you can do it from the comfort of your own home. So you don't have to really worry about going into a clinic, making that appointment, finding transportation. In our rural community, that's really important as well, because like I said, we're in an area where transportation is really, that's a barrier for a lot of our patients. So with saying that, Brig has a couple of polls. We were actually going to try to pull those up earlier on. I forgot to give you the cue,
don't
Brig,
worry
but
about
if
it.
you would.
You want to just jump to the barrier questions?
Yes.
Okay. All right. I'm not good at this, so bear with me, but we're going to put it out there. You should be seeing a poll now if you are able to do it from your phone. If not, just blurt something out. And we can't see who's answering. I don't think anybody would care, but we can't see who's answering what.
Camisha, there was a question from Brittany asking, where do you have the receptacles located within your practice? Do you have more to add to that? Because you mentioned
absolutely.
Yeah.
So we have in our main facility, our main clinic, it's kind of hard to describe how our bathrooms are kind of offset from the main facility, and they are single stall. It's a single single bathroom in each, but in front of that there is a wall, so that's where we have one receptacle. But in our other facilities, there are multiple stall bathrooms, and we just have them hanging on the wall right by the sink. So that way, if somebody is just wanting to grab one, they can grab it and go. We try to keep them high enough so that way small children can't grab them and get into them, because that was one of our issues we faced initially. We have it's called our China building. It's a facility building that we utilize for our health fairs and powwows and dances. We were able to put them in those bathrooms, but there were small children at some of those events, I guess, pulling them out and doing what small kids do, blowing them up, making balloon animals, and leaving a mess. So we had to brainstorm how we could still make them accessible, but also make sure we're not causing a mess or helping add to that. So one of the things that we were able to do is just move it up a little bit higher where they can't reach it. And then with that also came opportunities for conversation. So we were able to have conversations with people when there were a couple of people that were upset that children were able to access those. And one of our biggest goals is just to normalize it. We just want to normalize these prevention materials, just like you would normalize tampons or pads. We don't want it to be looked at as, oh, we need to keep this in secret and hiding. We want to be able to, we're wanting to promote health and wellness. And in order to do that, we really need our clients and our patients to understand that we're not promoting sex, we're just promoting health, we're promoting wellness, we're promoting prevention, because we want to keep we want to keep them safe and we want to keep them healthy. And so that's the conversation that we've had to have quite a bit, just because we do live in a conservative area and there has been some pushback with those.
Thank you, Camisha. And then Randy asked in regards to the questionnaire, if we'll share those out. So the plan is that we will share the PowerPoint slides with you folks. And so that, I believe, well, that's in the PowerPoint, but if we can, maybe we can send the full document.
Yeah, and I think Robbie was the one that created that for us too. So she might actually be able to send over a PDF as well if there's other programs that are looking to utilize that.
Absolutely.
Misha, can you see the results of the poll and then I'll take it down? Is everyone seeing it or only am I seeing it?
I think only I'm
Okay.
not seeing anything.
If only I'm seeing it, then we had sort of 4 out of 6 saying stigma embarrassment as the main issue, and then 2 out of 6 saying lack of knowledge. None on cost, access, or avoidance and fear.
Okay. So the stigma.
Oh, share results. I just learned how to do that.
There it is. Okay. Stigma and embarrassment. And we see that too. That's, I think, one of our biggest barriers. You have your people who shy away from the conversation, and you have people who are very confident in the conversation on both sides. That's why we promote it as much as we do every opportunity that we can. At every outreach event, we have something there, even if it's a school event and they're saying, hey, you can't bring condoms in. Okay, well, I won't bring condoms in, but I'm going to bring information about native tests. I'm going to bring the stickers. I'm going to bring the cards. I'm going to bring the handouts, the fact sheets. I will bring everything else because we're still going to try to normalize this as much as possible. We're not going to avoid talking about it. We're not going to avoid having the conversation, but we've learned how to be flexible. So that's kind of one of the things that I've seen a lot is we have to continue having these conversations if we're wanting to reduce that stigma, especially with our patients. And you have to, in each program, you're going to have to understand, like, there are some people who are going to be naturally able to have these conversations. We have one of those in our program and we call her our condom fairy. And I think it's really important for each program to recognize your champions when it comes to sexual health, because it is hard for some people to talk about. It's very hard for others if they don't feel confident enough about the information to be able to have these conversations with patients. So in order to get them there, you have to show the extra support and extra trainings and do motivational speaking. But if you have people in the program who are good at these conversations already, recognize them and empower them. Our condom fairy, she goes by her title and she very much wears it. We called her the condom fairy because she's the one who we go to, hey, it's time to refill the receptacles. Hey, this program is asking for more condoms. And so she does all the tracking for it as well, but she'll go all around the facilities, all over Perkins to make sure everybody gets what they're needing. But I like to just give that information out too, just in case anybody has any ideas within their own programs. But those conversations really are the key. When you're at those outreach events and you're handing out the information, it's easy just to give the information, move to the next person, give the information. One of the things that she was able to do at one of our outreach events is she was able to stop people and look them in the eye when she was giving them that information and was like, have you heard about this? And if they said no, then she would tell them the full spiel, every single one of them. And I mean, we probably had over 800 contacts at that one Thunder event alone, but she was good at it. And she made sure she hit every single one of them and she was getting that information out there. So that's kind of what I'm talking about, looking at those strengths within your programs and with different employees. You also have to kind of understand your audience too. I think that's really important. You're not going to have the same conversation the same way with an elder that you would if it was a young adult. And that's where we have to come from. we have to learn how to compromise more when we're speaking with our elders, because we do have to be respectful and respectful of their opinion. We may not always come to an agreement, but we just have to learn how to compromise. You may not like that we're doing this, that we're promoting it. We're going to explain to you why we're doing it, and then we're going to try to figure out how to compromise so that we're not making you feel uncomfortable or disrespecting you. So those are some other things that we've had to learn how to navigate. Oh, and this was I actually printed this picture off, and I gave it to her, and I told her she needed to hang it on our wall so that she could be well recognized as our condom fairy. She's our starting player for sexual health. And then here's some keynotes. I think when it comes to community health, and I know we don't have a whole lot of participants here, but with our community health workers, they really are key because they're the face of your programs, and they are the ones that are going to be getting that information out there. So it's really important to support them any way you can, with additional trainings and being able to train them on how to have those open conversations, to be willing to compromise. And it's also really important to learn how to create those strong networks as well. I'm grateful that we were able to network with Robbie. I'm grateful that we have opportunities to do more because of those resources, because without those extra resources and the extra funding, we wouldn't be able to do nearly as much as we currently do. I think it's really important. And it's really important to do that, to be able to document that, show the data, show your success stories when you're doing your reporting. So that way you can request more funding. I think right now we're in a time where it's hard. We're unsure if that funding is going to continue or not. And we need to make sure our voices are heard and do it in the best way we can possibly do it. And I think data is really important. And then that's all I have. So I will go ahead and pass this on to Robbie.
Thank you so much, Camisha. Camisha does amazing work with iOS, and I'm just so grateful for the partnership there. I'm always trying to go there and hang out with them because they're so amazing. And I love the community aspect of it all. So I'm gonna pull up my presentation. So sorry. One moment. Let me share my screen. I'm working on one computer today, so it's throwing me off just a little bit. All right.
I had to do that yesterday. It was difficult. It's like, where's my other screen?
I know. It's like, where is it? Okay. I think this is, yeah. Okay. Then we'll go into the presentation. There we go. Everyone able to see my screen?
Yep, looks good.
Yes.
Oh,
All right. Perfect.
so beautiful, Robbie.
Love the purple. I throw purple everywhere as much as I can. So I'm Robbie Bright. I'm with Southern Plains Tribal Health Board and local Tribal Epidemiology Center. We serve the 43 federally recognized tribes within our jurisdictional area, which is all of Oklahoma, all of Kansas, and then one tribe, the Kickapoo tribe of Texas. And then we also serve the IHS clinics and the urbans in between there as well. So I work on the Native Test program as the Native Test program coordinator. Today we're going to talk a little bit about Native Tests and also just HIV and STI community-led interventions as well. You're going to learn a little bit of the background, gained some knowledge about PrEP, PEP, and DoxyPEP and how you can do linkage to care in a non-clinical setting. And then also looking at community outreach and HIV and STI testing outside of the traditional clinical system. So a little bit about Native Tests. I always want to start out with Native Tests where I recommend as we're going along the presentation that you utilize the program. So for Native Tests, it is a program that you can text in. It's based off of SMS texting, so it doesn't have any data restrictions. So we like to say that you can be in the bottom of a hill and then in the most rural town, but still be able to order an HIV or STI self-test kit. This program also does have a website called nativetest.org, but for the texting system, you text the word native test to the phone number 55251. This program was established actually back in 2020 alongside a tribal nation within Oklahoma to create a bridge, to bridge a gap for self-testing during COVID for HIV. So this program started at that tribal nation and it just expanded and it got brought into the board to be what it is today, a national native test program. So we just see barriers with HIV and STI testing among our Native communities and populations. So with at-home testing for HIV and syphilis, which the syphilis self-test kit just got newly approved just this last year. So Native test is for anyone that is 13 years or older for both American Indian and non-Native individuals, because we think that everyone has sex with everyone, and as long as we can serve both populations, we will. So a little bit about a program overview of Native tests. So we provide individuals with a free HIV self-test kit. So the HIV self-test kit is an oral swab. It is the OraQuick OraSure federally FDA approved test. It is 20 minutes. So an individual will just swab their gums and put the test back in the solution and know their HIV status in 20 minutes. For the syphilis self-test kit, this is a finger stick antibody test. It results within 15 minutes. This is a test that is for someone who's never had syphilis before or doesn't know if they've ever had syphilis before. If you've had syphilis before, you will always have the antibodies within your system. So this test isn't the right test for you, but within the system, we help weed those people out and help connect them with care. We also have PrEP and PEP and DoxyPEP information within the system and sexual healthcare navigation. So we do have nationwide delivery. We've delivered to all the way up to Alaska and the lower 48 and Hawaii as well. Typically for Alaska and Hawaii, we work with our tribal partners within those jurisdictional areas to provide those services to those individuals. We say we house Native Tests, but truly the Native Test program is ran by our community partners. There are different versions of Native Test, a little bit with different tribal nations, and we have co-branded partnerships with tribal nations as well. Across the United States, we have over 98 community partners, and we're always looking to gain more and make the system work for however it fits within your own community. So this just gives you a little bit of an overview of the mail-out system so far. So for Native tests on the HIV self-test kits, that was established in 2021, so we've been doing it longer. Originally, it started in Oklahoma alone, and then we expanded it to become nationwide. So we have mailed out almost nearly 12,000 self-test kits. The syphilis self-test kits just began this current year in late January, and so far we've mailed out 87 of those. For those self-test kits, we have not done any paid marketing, which we can kind of get in that as well. So this has just been by word of mouth through presentations or from people accessing the Native Test system for the HIV self-test kits. We also have the community partners highlighted in blue as well. So you can see throughout the United States where our community partners are. With the community partners, they have marketing materials such as laminated clinic room flyers, posters, stickers, whatever works for their area, they have that. Some community partners, as I mentioned, are co-branded and some just have the regular marketing. It's truly whatever works for the area themselves and what that they best feel will impact their community. So with the self-testing model, so why would we do self-testing versus clinical testing? I always recommend if someone is comfortable accessing the clinical system that they go see a provider and they go into that clinical system because that's a way that they can take care of their whole person health. But sometimes people aren't comfortable always accessing the system, or maybe they don't have time for an appointment in the next couple weeks and they want to know their status now. So the benefits with self-testing is it increases someone's confidence and confidentiality surrounding self-test kits. It's also very convenient. Sometimes appointments can take a week or two to get in to a provider within the area, especially if there's only one provider. That also goes in that confidentiality moment. I know HIPAA's a thing, but sometimes it can be a little scary to go into a clinic whenever you know the people at the receptionist. So this helps people have that autonomy to be able to know their status in the comfort of their own space. We also utilize priority shipping for this program. So an individual could order their test kit today. We work off of business hours. So if they order it today, they should receive it within 2 to 3 business days. So it's possible they'll have their test kit by Saturday if you live in New York. If you live in closer to the Oklahoma state, you should receive it in 1 to 2, but it could go up to 3 days. But that way an individual is receiving their test kit in a timely manner. We also worked with the Oklahoma State Department of Health to get a rate of positivities from the HIV program. And we had identified 54 individuals that were HIV positive and linked into HIV case management care from the native test program. So we do have a higher positivity ratio compared to the traditional testing ratio. A little bit about PrEP, PEP, and DoxyPEP, because, there's so much things that you need to know in the community health realm that you can't know all of the interventions that can help prevent HIV and STI. So I wanted to touch base on those a little bit today. So PrEP stands for pre-exposure prophylaxis, which is a medication that you can take in a few different ways, but it helps prevent an HIV infection. So you can take PrEP on demand in a pill form or an injectable. For the injectable, they're even about to release a new injectable, which would be every 6 months. Currently, it's every 2 months. They can make a plan with their healthcare provider to see which PrEP method will work best for them, to see if they're better for injectables or if they're better for pills. That's where they'll meet with their healthcare provider to determine that plan. There's also post-exposure prophylaxis medicine. So this is a medicine that you take within 72 hours of being potentially exposed, either through sharing needles, injection drug use, or through sexual encounters. This medicine will help someone prevent an HIV infection. There is also a not too newly, but DoxyPEP, which is the common doxycycline antibiotic. It's called DoxyPEP for short, which is the post-exposure prophylaxis for STIs. So this helps with chlamydia, gonorrhea, and syphilis, where a person can take just like 200 milligrams of doxycycline up to 72 hours after an encounter, and it helps prevent them from getting those infections. So for PrEP and PEP, the native test program, we help provide individuals with information on PrEP. We don't provide all that details I just gave you. Due to character limits with the system, we wanted to ensure that people can get some information about PrEP and PEP without needing internet access. So we give them just a blurb about a little bit about it. And if they're interested for more information or to get connected into care, or they can utilize our PrEP Talk system or native PrEP as well. And with this, we will confirm that an individual wants to talk to us about getting linked into care for PrEP, and talk about more PEP or DoxyPEP, and then help find a clinic nearby them, help ensure that they can get an appointment, and then also follow up with them after their appointment to ensure that they didn't have any problems accessing the system, and then make sure that they got the medication that they needed. So I kind of just talked about that. So what does PrEP navigation looks like? So with PrEP navigation, an individual requests for someone to talk to them in the native test system. We, before calling the patient, will actually look at systems nearby them and call those clinics if we're not familiar with the clinic. Since it's nationwide, I usually typically have to call all the clinics. I'll pretend to be a patient and I'll see what it feels like to try to schedule an appointment there, and make sure that it's a comfortable facility for that patient, and then go through that process of following up with them 2 weeks later to ensure that they were able to access and start their PrEP medication. So with sexual healthcare navigation, with the Indigii I Want the Kit program pausing, which was an at-home STI program, we launched sexual healthcare navigation to help individuals navigate the healthcare system, just similar to the PrEP navigation. We just expanded the service to include other things such as STI testing. Since launching this, we have provided a gold standard of a warm handoff for expanded STI testing with the tribal health system, and they were able to access care within 24 hours versus having to wait for a new appointment as a new patient. So with community engagement, this is one of the best ways that we do HIV and STI interventions, alongside PrEP medications and DoxyPEP and things like that. With community outreach, we're able to target our population, which is American Indian Alaska Natives, and have community outreach and trust building. So community members can know that they can trust us and that we're going to keep coming out to their health fair events. I know one time I had someone and I didn't bring the right pin that I brought the last time. And they're like, where's that pin at? I wanted to get another one. And I just didn't bring it that one time, but they engaged with us and they remembered us and they knew that we were there for them. And that was amazing to hear. And I felt so bad that I didn't have it for them that day. With community partners, as I said before, they really do run the native test program and it can look however it needs to look for their area. We've gained these by word of mouth or outreach events, conferences, and we really do focus on like our tribal nations within our jurisdictional area, but then we have partners nationwide as well. Just going over our native test program successes a little bit. We've given out over 300,000 condoms, over 10,000 lubricants, over 6,000 dental dams. We've attended 112 community events in the last 2 years. And then we've also dispensed over 84 of those condom dispensers that Camisha showcased. We also work on doing point of care testing and DIS work within the system. We're a board that doesn't have clinical capacity. So we work with our federal partners and tribal partners to be able to provide point of care testing, which is a great way to do point of care testing for. For the native test program, we do offer bulk kit distribution to partners that are within our own epidemiology center jurisdiction, so Oklahoma, Kansas, and Texas. And we do have 25 of those, Iowa's being one of them. With the bulk kit distribution, this allows for an individual to know that they can access the HIV and syphilis self-test kit without having to wait on it to be in the mail. This is a great way for people, another point of access. So I do want to show some trainings. I talk about all these things such as like DIS work or sexual health, all these other topics, and it's really hard to get in the space without knowing what trainings to look for to get into. How do you do PrEP navigation? How do you learn about those things? So there is a document, I know I'm still sharing. I'm just switching it really quickly. There is a document that we can share out afterwards that kind of goes over sexual health related trainings that's broken up between like providers and nurses and community health workers. If we're being really honest, this isn't something that's truly professional or as pretty as it could probably be developed, but in the current climate, this is what we have and this is where we are. There were a lot more trainings that were available, but things were just taken away. So these are all currently active. I verified them just last week, and I have someone doing like 4 of them right now. So it kind of goes over different working with clients to stop HIV transmission. How do you frame conversations, HIV care and sexual health assessment. And a lot of these also provide free credentials for anyone who may have like a CHES or things like that. So these are really good training opportunities that are all available for free and virtual that can help build your own internal capacity or those that you work with capacity surrounding this topic matter. I personally have taken most all of these, or there are ones that are on my radar to take if I hadn't taken one. So I do really recommend them. It's kind of a big document. We'll share them all, but they're really great to build your own internal capacity surrounding these topic matters. And let me go back to my presentation. So sorry. There we go. All right, I think we're at the questions part, so I'll escape and stop sharing. Oh, there, stop sharing for me.
All right. Thank you, Robbie. Okay, so does anybody have questions that they would like to ask of either Robbie or Camisha? I think, Alicia, at this point, we can go ahead and stop the recordings.